Hi, everyone. This is Professor Widener with Chapter 23, Ethical Considerations for Evidence-Based Implementation and Evidence-Based Generation. Whenever we're considering doing any changes to practice, whether they're research or making changes to a current practice, we always have to remember that patients are at the end of this and we have to do what is in their best interest. And there are some core principles that we need to be reminded of and refreshed as we're thinking of our projects. And remember that evidence-based practice involves using evidence to improve practice. That the difference is that we're not doing research. We're not generating new evidence. We're using someone else's evidence to see if we can see that it results in improvement to practice. Once the improvements have been made, then the outcomes can be evaluated. There are ethical principles that must influence both the importance of evaluating the impact on patients and the way those evaluations are conducted. There are some ethical principles at the core of what we do, and just refreshing some of those definitions. Benefits is where you capture the importance of doing good for patients. Non-malfeasance means that you do no harm to the patient. Autonomy acknowledges that patients have the right to make their own decisions about their health, lives, and body. Justice reminds us that resources should be distributed fairly among people without prejudice, and fidelity is to capture the importance of trust and honesty in doing a study or performing interventions. There are 15 ethical principles of Universal Declaration of Bioethics and Human Rights. These are standard, and there's, I'm not going to read through them, you can read through them, but there is a standard citation on the next page. These are generally accepted rules across the world about what is important when dealing with bioethics and human rights. Some of the comparisons on that: there are core ethical principles, and there are also Institute of Medicine's core dimensions of quality. And the Institute of Medicine is in the United States, and this is kind of a chart to show how the two of those work together. The Institute of Medicine, they talk about safety, which equals the core principle, ethical principle of non-malfeasance. Effectiveness equals benefits, and patient-centeredness in the IOM quality dimensions equals autonomy. Timeliness, again, we're back to benefits and non-malice, do no harm and see benefit. Equity equals justice, and efficiency equals benefits and non-malfeasance again. Just to see that some of these words are similar, yet they have different names in different societies. But again, the main principle being do no harm to these patients. Question number 1, which of the following is not an ethical principle? A, human dignity with human rights. B, preparing a well thought out study. C, autonomy and individual responsibility. And D, privacy and confidentiality. The answer is D. Although a well thought out study is super important, it is not an ethical principle to have that done. The other 3 listings are actually ethical principles. So we're going to talk about ethical conflict and evidence-based quality improvement initiatives. And there can be times where ethical principles and quality-based initiatives can conflict with ethical principles. So attempts to improve quality for some patients may harm others. Strategies intended to improve quality may turn out to be ineffective and waste resources, which even now in light of COVID, resources are more scarce than before. And activities declared to be evidence-based practice or evidence-based quality improvement may more accurately actually be described as clinical research. So there's actually a line between there. And this next slide talks about differentiating research and quality improvement and evidence-based quality improvement. Clinical research is where you have human subjects or material of the human origin, and you're going to the researcher will do a topic on a study. It generates knowledge in which practice should be based. Remember, clinical research is brand new knowledge. So it's a knowledge-based deriving activity. Quality improvement initiatives are usually systematic. They're data-driven activities designed to immediately improve healthcare delivery or in specific settings. So think about like quality improvement teams in the hospital, how they try to work on improving, for instance, at the hospital where I work as a hospitalist, we were having problems meeting sepsis measures. So we instituted a bunch of things that we thought would possibly help. And they did end up helping, but that was more of a quality improvement project. It was not research, and it was not necessarily evidence-based. When we combine evidence-based quality improvement with the two of those processes together, it impacts process outcomes. The interventions or strategies that we use, that we derive from evidence-based, are then put into quality improvement projects to help improve something, and that also are then implemented and evaluated with the results. And this is another way to look at the difference between evidence-based quality improvement and research. So I want you to think about being part of the evidence-based quality improvement team, whether you're in the MSN program or the DMP program. Research focuses on discovering the answer when it is not known, where quality improvement or evidence-based quality improvement focuses on implementing the best evidence with the best processes. So you're going to actually look at a bunch of different research and then decide what is the best process. It does carry some risk for patients, where evidence-based quality improvement carries little to no risk. Researchers are often not part of the patient care team, but again, they could be, where evidence-based quality improvement are usually part of the care team. In research, most funding is external, where funding, if it's available for quality improvement, is usually generated internally. So sometimes you can get money through like projects within a system or something to work on this. Research findings are often generalizable and can be applied to many different scenarios, where in evidence-based quality improvement, they're not generalizable and may be transferable, but these are going to be focusing more on a specific population. And in research, publication is the expected outcome, where you'll publish what you find and then other people will test it. And that is where evidence-based improvement comes in, where you will disseminate the information, which may or may not include a publication. There are 7 ethical requirements for proposed applied research that should be used, and we're going to go through all these a little bit more. Social or scientific value, scientific validity, fair subject selection, favorable risk to benefit ratio, independent review, respect for potential enrolled subjects, and informed consent. So let's just talk through each of those a little bit more. For social and scientific value, in research or evidence-based quality improvement, to be ethical, it should be worth the time, the resources, and the risk. In other words, it needs to add something to society or to scientific value or knowledge. Scientific validity means that research projects must be conducted in a methodical way to ensure the validity and generalizability of findings. Poorly designed research projects or poorly implemented protocols are a waste of resources and those involved. Fair subject selection should include specific inclusion and exclusion criteria, and patients involved in evidence-based quality improvement should be determined by a population of the patients served by the organization, rather than just the ability to generalize the outcomes. So they should be able to be applied to every patient within whatever group you're working with. Their favorable risk to benefit ratio, research and evidence-based practice quality improvement must be committed again to be ethical, to minimizing the risks and maximizing the gains for everyone involved with the project. For independent review, it must be reviewed by an IRB board, which is an independent review board. We do have one at Misericordia, and if you are a DNP student, you'll have to present your project to the IRB, and that is where they're a group of independent people who evaluate your research, decide if it's ethical or not ethical. And the reason they do that is because of the potential interest and results of human subjects being violated. So we want to make sure that whenever we're working with humans, that their rights are protected and we're doing the best thing for them. Respect for potential and enrolled applicants. The well-being of the individuals in the subject takes precedent over any other interest. And remember that they can refuse treatment of your evidence-based protocol, which is their right. Informed consent is whether for research participation or treatment is a component of clinical and research ethics. And again, informed consent, just like when you think about it as when you're going to get a surgical procedure done, again, this is an informed consent that lists the risks, the benefits, and the alternatives to patients so they know what will be involved when they're getting involved with your research or application of evidence-based project. A few final dilemmas. The ethical commitment to care for and do good for patients, coupled with the avoidance of harm, implies a commitment to improve clinical practice whenever possible. Professionals and organizations have an ethical responsibility to conduct these types of projects to demonstrate whether evidence-based changes are sustainable and improve outcomes. This commitment places a responsibility on patients to participate in the IRB initiatives, the evidence-based protocol initiatives, but again, they have the right not to do that. Hopefully we can educate them enough that they buy into what we're thinking and want to be part of that. So for research, there is always an informed consent, but there is a great debate as to whether or not informed consent is needed with evidence-based quality improvement projects. And when you look at both sides of this, there's a debate whether patients should expect evidence-based or quality improvement as part of standard healthcare, or if the informed consent is needed if patients are actively participating in decision-making, which is one of the cornerstones of evidence-based process. There are groups such as the Patient-Centered Outcomes Research Institute that allows patients, their caregivers, and the broader healthcare community to drive research agendas and help to ensure that ethical principles are upheld. This goes on to talk about IRBs and whether they are required or not, but I can tell you at Misericordia, the expectation will be that you will present if you are a DNP and you're going to perform your project, that you will present your project to them. This is basically going to be answered by organizational policies and procedures to address these questions. And again, I feel like as nurses, we've been charged with a very ethical profession, and we're involved with people at some of their most intimate moments of their lives. So if something doesn't feel right to you, then make sure you further investigate that or get information or have someone help you work through whether this is an ethical issue or not an ethical issue, because there's multiple ways of looking at things. And part of our job as advanced practice nurses and doctorally prepared providers is to be able to look at all sides of that coin. All right, and last question. A controversy about ethical principles is applied to evidence-based quality improvement versus clinical research is most clearly seen in which of the following domains of ethics? And it's independent review. And that is where it is generally acceptable, and there's some controversy surrounding the question for the need of independent ethical reviews. And again, it will be driven by the processes of wherever you are. So thanks for listening. And if you have any questions, just let me know. Take care.